life. It is Saturday evening. Today we're going to discuss about something that has been disturbing a lot of us, something that is, if recognized early, could be very much preventable and treated. Today's session is going to be very important for you. We're going to throw the light on a lot of issues and a lot of precaution and prevention measures that you can take to avoid this kind of problem. We are talking about the kidneys. We are talking about a very important organ in your system called the kidneys. 120 grams, very small thing, but it does an amazing job. This amazing organ here filters out the blood many hundreds of times in a day, and it doesn't get tired, it doesn't need battery, it doesn't go bad unless you make it go bad. So let's talk about the kidney today. A lot of people in Cameroon and in Africa in general have kidney problems for different reasons, most of the reasons that affect the kidney, you are the reason. You causing those problems by ignoring simple advices that we have been saying, by taking things and putting things in your mouth. You don't know where it is coming from, you don't know what is the effect on the kidney. You know, even comes even to some health professionals prescribing medicine for a long periods of time, not knowingly that this medication for this specific period of time can cause kidney damage. We will be talking about the kidneys today, so I need your attention for the next few minutes. Any doctor's office right now today has what is called an ultrasound scan. You do not walk into an office today in the cities, in the big cities, without seeing an ultrasound in the doctor's office. So when the doctor consults you, take the history in order for him to see what else is there, or to confirm what you have said, or to confirm the list of suspicion that he has in his head, then he must do an ultrasound. We call it fast-track ultrasound. Fast-track ultrasound, the doctor or the health professionals know what they're doing. They will scan the whole organs, starting from the heart, the epigastric area, the liver, the kidneys, the prostate, the heart, everything is fast-track. We look at everything quickly. Uterus, ovaries in case of female, prostate in case of male. We look at all those organs very quick to make sure everything is okay. Believe it or not, many cases that the patient comes just for a checkup and we found things that, wow, I didn't know I have this. So it is advisable every now and then, especially when you pass the age of 40, to do general, regular checkups using an ultrasound. And by the way, since it is the month of December, we have a very good promotion, which is we always have free consultation, free ultrasound. So I'm going to throw for Christmas kidney check, that is kidney creatinine, to measure the kidney function. All right, so let's talk about the kidney. What is the function of an ultrasound? How can an ultrasound help me as a physician in recognizing kidney problems? Believe it or not, the best investigational study to know what is wrong with the kidney is the ultrasound. What do I get from the ultrasound? Number one, stones. That is number one imaging studies, that we can see the stone, we can measure the stone, we can also tell where is the location of the stone just by simple ultrasound. Now, what is the damage then a kidney stone can do? We will be talking about kidney stone, what is the reason why we form in kidney stones, but let's talk about the consequence as far as in kidney injury when we have a kidney stone. When you have a kidney stone, what happened? That's an obstruction. And remember, when we talk about the kidney, the obstruction doesn't happen inside the kidney. There is only one chance of 3 other chances that obstruction can take place. We have the kidney that is mainly a cortex, which is the outer layer, and that is the most important layer. This is where all the kidney function takes place, in that outer layer called the cortex. The second is called the medulla, okay, where it has small pyramids there. And then we have a pelvis, where the urine collect, and then we have a ureter, which is just a pipe that takes the urine from that kidney into a storage area called the bladder, and from the bladder then you let the urine outside. Okay, that is very much in a simple way the structure of the urinary system. So when we have a kidney stone, that's an obstruction to the urine. And when we have an obstruction to the urine, what happens as a result? The urine, instead of going down to the bladder, it backs up to the kidneys and it accumulates in the kidney. You know, the pelvis of the kidney is very small. So now when the urine backs up to that pelvis of the kidney, as a result, it will expand. So that now that small pelvis there will become bigger, and more urine to back up to the kidney, the pelvis becomes even more bigger. Now the pyramids of the kidney become filled with urine, and they expand more, they expand more, they expand more. So now what we have here, we have hydrostatic pressure. In other words, we have pressure. That obstructive urine that is not allowed to pass because of that obstructive stone now create back pressure on the pelvis of the kidney and as well the kidney. Which layer now is affected? If we have the medulla and the pyramids full of urine, which is the middle part of the kidney, has already been building pressure because of that back pressure coming from the accumulation of the urine ascending up to the kidneys. So what will be affected? The cortex of the kidney, the outermost layer of the kidney. As a result of that, we have just mentioned a minute ago, the function of the kidney lies in the cortex. The cortex of the kidney is the most important layer of the kidney. Now you have pressure pushing against that cortex of the kidney, pushing more against the cortex of the kidney, more and more and more and more and more. That extreme pressure, day after day, week after week, month after month, we will cause that cortex to deteriorate, to be injured, to be bad. As a result, we will lose the function of the kidney because we have injured the cortex as a result of leaving that urine accumulating for so long without intervention and getting the urine out. What is the rule? When we talk about the kidney, there is one very important rule that we have to say about the kidney, which is urine, 3 words, urine must flow. This is it. This is the rule for kidney. When the kidney form urine, this urine must flow. So the kidney then is the barrier, is that shifter between the blood in one side and the urine in the other side. The urine is the excessive water that you have, the body used what the body needs of water, the excess you urinate. Okay? All the toxins in the body, the blood being shifted in circles like this every couple of, when the cardiac cycle continue, that's also, as every cardiac cycle that goes through, it goes through the kidney as well, and the kidney shifter, that blood from all its toxins and the material that shouldn't be in the blood has to be shifted through the kidney. And since the kidney is a shifter, then that shifter has a specific size holes, has a smaller size holes. Why? Because there are stuff in the blood that should be kept in the blood. Like when we discussed about the lady with ascites, we said the main reason this lady, and I think was the last session, the main reason that this lady is having ascites. By the way, I examined the lady today before I come, couple of hours before I come, and now she is fine. Why? How long did it take us? A week. What did we do? We give the special formula that I make, we call the gum, to reverse the bad kidney function. We give few medications, and now there is no fluid. I checked her today with the ultrasound. There is no more fluids in the abdomen. There is no more fluids in the legs. The legs are normal right now, and everything is happy. At least we have a smile on her face. Her family very smiling and happy, and the condition is reversing. Is not fully reversed yet. The condition is reversing, but is not fully reversed yet. If you can remember, that lady has 2.6 albumin. And the problem was not the liver failing to make albumin, was actually the kidney not shifting very well and losing albumin to the urine. So the problem was not the production problem, the problem was flow. Then anything that obstructs the flow of the urine will cause me problems. Now, when we talk about obstruction, we have three main gates, three main constriction areas that the stone can get stuck. We will talk today about how can a stone form, what makes a stone form. Anyhow, the stone doesn't form, boom, overnight becomes a stone. No, it's small sand, small dust that becomes sand, that becomes gravel. Then those pieces of gravel coalesce together to make a bigger stone. So the same way it forms by our treatment, the same way we break it into parts. To grab, we loosen the adhesion between each small calculi and the next. We break them apart to the original pieces, which is dust, and then down to the urine. Sometimes we get the whole stone down, and we have a sample, we have a stone. I have few stones actually in the clinic that I forgot to bring to share with you to show you how the stone look like. Even some of them is above 11 millimeters that we have dropped in the urine. So back again, we have three areas of constriction in that urinary system where the stone can get stuck. First one is up in the kidney, right after the pelvis. After the pelvis comes the pipe that will take the urine down to the bladder. We call that ureter. So before that pipe enters the bladder, which we call the bladder inlet, which is the gate into the bladder, we have a constriction. The stone may get stuck there. That is the second constriction area that the stone may get stuck. The third one is at the bladder. When the urine exits the bladder, we call that the bladder outlet, and the stone can get stuck there. So those three main constrictive areas where the stone can get blocked, and those are the areas that the stone passes through those areas, the stone is out. As the stone passes through the ureter, it scratches the ureter, causes a couple of drops of blood to be in the urine, so you may see dark urine, brownish urine. And it's all because as the stone comes through the ureter, it causes a couple of drops to be present in the urine. No alarm, that's a good thing, the stone is dropping. But those who have kidney stones, yes. So this is a diagram, a nice diagram that shows the kidney pelvis, which is the black area there, and those two pipes going to the urinary bladder. Those actually what is called the inlet of the bladder, and then down below will be the outlet of the bladder. As you can see, there is a stone there in the ureter. As the stone goes down, it scratches off the ureter, and as it scratches off the ureter, not only that you will see blood in the urine, but you will feel a lot of pain. And the kidney pain, the colic pain of the renal colic pain, is the worst kind of pain you wanna have. It's very traumatizing, that you have to take an injection of analgesic immediately and something to release the spasm. Okay, so it's a very painful pain, but it doesn't last. It stays for a few minutes and then it goes off, and few minutes later you get it again. It depends now how the stone is moving. Till the stone is out of the bladder, the pain will stop. As long as the stone is moving through the bladder, through the ureter, then you will get the pain. So now we discussed the kidney stones. You know, we have not discussed it fully yet, because we need to know, and we will know inshallah today, how the stone forms, at what makes the stone to form. Myself, I'm a stone maker. I make stones. My body makes the stones, and we'll discuss my case and your case, or whoever, anybody who is similar. So we're gonna see. I haven't had stones for many years. We thank Allah for that. But you know, we will see how can we prevent the stone from happening. Very simple, very simple. So now, we've seen the stones, we've seen when the stone passes what kind of dilemma you go through, and we see also the bad consequence of having a stone for a long time, which is when we have accumulation of the urine inside the kidneys, a condition called hydronephrosis. Hydro means water. It's not really water, it's the urine. So, but we call it hydronephrosis, meaning water inside the kidney, which is, it has degrees now. We have grade 1, 2, 3, and 4. You know, so, and that the higher degree we get, the more damage that we can cause the cortex. And that's what we do not want to get to that point. So the minute we have a stone, we need to drop the stone before we reach to hydronephrosis. So we talked about the stones. We talked about how we can see a stone. The best way is, doc, I have a pain in the waist. I want you to see if you have a stone, because that is the most common presentation. Waist pain. My waist is paining. Now there is different kinds of waist pain. The colic renal pain is, colic mean comes and goes. Is episodic. It comes, like we discussed a minute ago, as the stone moves. And it goes when the stone stops moving. So colic, episodic, comes and goes. There's different kind of waist pain than when we have degenerative disc, for example. How would you know you have a degenerative disc or not before spending hundreds of thousands of money on MRI and CT scans and all that stuff and all this investigation? Basically, you lie down in your back. You have somebody lift your leg. Somebody has to lift your leg without resistance from you. And we see how far how far this leg can come to your abdomen. Once the leg comes very close to the abdomen and you get the waist pain, you have a disc problem. You do the same maneuver with the other leg. You raise the leg all the way almost to touch your abdomen. If you get waist pain, then you have a disc problem. Then we recommend that first we do an x-ray and to see what is there. If we need to go more advanced, we'll order more advanced imaging studies. If you get the pain only on the thigh, that is not a problem. If you get the pain on the buttocks, that is not a big problem. There is a problem, but at least it's not a disc problem. And so on. So that's an easy way when we talk about waist pain, what you should do at home to find out if there is actually a disc problem or there is just, you know, a waist problem. A waist problem meaning a disc problem. And the other kind of pain that comes and goes, and that is most likely related to a stone passing through. So let's take 1 minute break and we'll continue talking about the kidney. At least we clarified in this section kidney stones. In the next session, we'll talk about different kidney diseases and why someone forming stones.
When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by ELISA just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at mile 18 Bomaka. In Vola, you can find us at Bonaberry, precisely at Entrée Pilote. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
Welcome back. We talked about kidney stones. Let's talk about the kidney now. How can someone know whether the kidney is good or bad? We talked about the importance of an ultrasound in evaluating kidney. How do you think I send somebody to do kidney profile test and somebody don't send to do kidney profile test? Is what I see in the ultrasound. So beside the ultrasound being very important and #1 imaging study when it comes to kidney stone, I can also use the same ultrasound to look at the kidney and see the texture of the kidney. Is it light color or is it dark in color? Comparing it to what? To the next organ. So if we're talking about the right kidney, I compare it to the color and texture of the liver. The kidney is supposed to be darker than the liver, and that's a good kidney. If we're talking about the left kidney, what is the nearby organ? The spleen. So I have to compare the spleen to the next next by organ, which is the spleen. So the kidney should be darker than the spleen, and that's a good kidney. What if I look at the kidney and it's very much the same color as the liver, and the other kidney the same color as the spleen? And that was the case, by the way, for that young lady that we have just treated. When I looked at the kidney, I find the kidney same color as the liver, left kidney same color as the spleen. It's just that capsule of the kidney that is demarcating the kidney that tells me, hey, this is a kidney and this is a spleen. This is a kidney and this is a liver. That's it. But the color is very much the same. We call that in terminology, in ultrasound terminology, ISO means same, echoic means same color, same texture, kidney and color. Will be more appropriate to say same color, isoechoic. While the kidney is supposed to be hypo means less, hypoechoic than the nearby organs, which is liver on the right side and spleen on the left side. Very good. So the ultrasound is also very helpful to tell me, red flag here, send this guy or this patient to do that lab, to do that kidney profile. What were we looking at the kidney profile? We're looking at something called creatinine. That is the easier, approximately accurate, approximately, not 100%, approximately accurate. And I'm going to tell you how you make this creatinine very accurate for your use as a doctor or as a physician or as a health clinician or health practice. What you do, creatinine coming from where? From muscles, right? Creatinine coming from muscles. So now, the value of creatinine should be around 1. That is the normal value. Now, if I get somebody who is 100 kilogram and I do his kidney profile, I do his creatinine, and I find it 1.7, 1.6, 1.7. Now I say, this guy has a kidney problem? No, he doesn't. But you just said normal creatinine value is around 1. This guy is 1.7, so he has a problem. He doesn't have a problem. Because we are not computers. We have to factor in that this guy is 100 kilogram, all muscular, lean body mass is huge, so I expect the creatinine to be a bit higher than normal, and that would be considered normal. Okay? A guy, bodybuilder, assuming he's not using any hormones, and is all lean body mass, 100 kilogram, his creatinine in normal scenarios will be 1.5, 1.6, 1.7 is normal. Because creatinine comes from muscle and he has a lot of muscles. Simple. Because there is a direct relationship between creatinine and lean body mass. So, on the other hand, if I have, 100 years old lady that doesn't have any lean body mass, and the creatinine value shows 0.5. Is a red flag? No, it's not a red flag. It is also normal. Why? Because she doesn't have the lean body mass. And what else? Because she is old. And there is an inverse relationship between age and creatinine. So as the age advances very high, I expect the creatinine value to drop below the 1. So now we have to adjust our thinking and evaluation of creatinine to evaluate correctly based on other factors as well, if I'm going to use creatinine as a parameter. Now we have equations to tell us what is the filtration rate, glomerular filtration rate, which you don't need to know. All you need to know here in these sessions is advice how to prevent a disease, when you should go to the doctor, have a general health education about your body. That is the purpose of this program. So, we rely on creatinine. Creatinine is directly relation to lean body mass and inversely relation to age. So we give the 2 examples and we understand. This is about creatinine. Now, we had patients with stones, we drop the stones. As far as the treatment, we drop the stones. Inshallah, we drop the stones. We have our own approach We follow the protocol also that is by the Urology Association, Medical Urology Association, but there is also other things that is being done, okay, that help drop the stone, that maybe, you know, few people use it and it works beautifully. If Mr. Johnson have that video with that guy with the kidney problems that we have taken care of, maybe it's time to play it, and then we'll have a couple of comments about that video and discuss the case of that guy. You tell them in your own word now. How much was your creatinine a couple of weeks ago?
I arrived this hospital 2 weeks ago, and my creatinine was 13.9. And I was told my kidney has failed.
Yes.
That is total failure of the kidney.
Yes.
And after 2 weeks of treatment, I did a test yesterday, and it is 1.4. 1.4.
The test today
1.4.
is 1.4 for creatinine. Congratulations.
Thank you.
23rd of November. Creatinine was 13.9.
Yeah.
We'll give you 2 bottles of gum, right?
2 bottles of gum.
2 bottles of gum.
2 bottles of gum.
Right.
Yeah.
And how much is your creatinine today? Creatinine today is 1.4. Back to normal.
Very good.
Yes, we thank God.
Thank God.
2 bottles of gum finished. 2 weeks, right? How long did you take it for?
It's 2 weeks.
2 weeks.
2
From
weeks.
13 creatinine
Yeah.
to 1.4.
1 point.
Excellent. It's no secret how we reverse the kidney function. It's a raisin that grow in big old trees, specific raisin. 2 of them, we mix them together with a specific percent. How many to how many? How many grams of this to how many grams of this? Virgin olive oil, virgin coconut oil, virgin sesame oil. When I say virgin, that means it has not been treated with sodium hydroxide. This refined, nice looking oil that you see in the bottle coming from United States or coming from Europe is not the one. You cannot use that. It may look good, but it's not the one because it has been chemically treated. We don't want that. When I'm talking about virgin oil, we're talking about a seed that you squeeze and the oil comes out of it. Cold press will be better. That's what we call about, that's what we talk about virgin oil. Why I'm using virgin oil and I'm not using that fancy looking bottle coming from Europe or USA, wow, very expensive, because it doesn't have any value to me. It has lost all its antioxidant value. What did I say? Oxidant, antioxidant. So we have oxidative molecules, toxins. When we're talking about oxidative molecules, we're talking about toxins that has caused the kidney, like exactly like your drainage at home. Doesn't it sometimes get clogged up, huh? And it doesn't function anymore, and the water backs up and is no more good? The shifter has gone bad. Pretty much the same thing. Toxins, too much toxins, and inability to eliminate those toxins get to the kidney. So the treatment will be eliminate the toxins and give the kidney room to breathe and comes back normal to its function. So when we talk about we talk about olive oil, but you cannot take olive oil by itself and expect the kidney to be fine. It's a formulation that has to be done, certain percentage mixed with that raisin, and then the kidney is back to normal. Everything is supported 100% by research and results and conclusion. Not talking from my head. We're talking based about research, positive results of the research, and no side effects. You see? We're going to talk about side effects because I cannot be treating the kidney and damaging something else. Like we're going to discuss later on in the show today about somebody treating the liver but damaging the kidney. We cannot do that. We have to consider what is good and what is bad, and this treatment has no side effects, only positive, alhamdulillah, and it reversed the kidney. It reversed the guy, creatinine, from 13.9 to 1.4. He still have to lose 0.4, you know, so, but he's good. Because if you look at the guy, he's about what, 80 something kilograms, and he's about lean, he doesn't have much fat. So 1.1, 1.2 creatinine value is okay for him, is the normal value. Who would believe after 2 weeks, a guy that was subject to, okay, now you only gotta go dialysis, and after 2 weeks, he's happy. He didn't go dialysis. He got cured. The kidney function was reversed back to normal, which we thank God for that. Is absolutely God's work. I'm just a tool. So now, let's talk about now things, you know, when we talk about the kidney, it's a bit complicated. We're going to be talking about metabolic acidosis. But before we talk about metabolic acidosis, what is metabolic acidosis? Meaning the blood become acidic. When the blood become acidic, it is bad. When the blood become acidic, is bad. And the blood can become acidic not only because of the kidney. The blood could be acidic also because of the lung disorders. Let's see how. If you have any situation that causes you to hypoventilate, hypo mean less, ventilate meaning you are breathing less. Any situation like a brain lesion, for example, like any lung disease, for example, that causing you to breathe less. Breathing less meaning what? Meaning you are not, you know, blowing off carbon dioxide. Carbon dioxide, without going into a lot of chemistry and complication, carbon dioxide should be considered in your head as acid. Okay? Because it's carbonic acid. Anyway, carbon dioxide is acid. So when I'm hypoventilating, I am not blowing off carbon dioxide out to the air. I'm retaining carbon dioxide inside my body. I become acidemic. So that is because of respiration problem. Now I call that respiratory acidosis. I become acidemic because I cannot blow off carbon dioxide. On the other hand, if I have any situation with hyperventilating, you are hyperventilating mean hyperventilating. If you have any situation that can cause hyperventilation, let me give you an example. You're anxious, you're afraid, you're scared, and anxiety is high, you hyperventilate. So what does that mean? You're blowing off a lot of CO2. That means you lose an acid. That what's to happen is going to have alkalosis. Then you're going to have respiratory alkalosis because it's all about the lungs that cause the alkalosis. So we call it respiratory alkalosis. So this is quick to understand about alkalosis versus acidosis when it relates to the lungs. But believe it or not, the kidney does the same thing at a much higher level. So when we have acidosis in the blood and the lungs or the brain is not the cause, we think about the kidneys. So the kidneys can kill you by means of acidosis. That is why we revert to dialysis. Because I don't want to die. I don't want to go into severe acidosis, metabolic acidosis, and go in the ICU and go in confusion, and you know, acidosis is bad. Okay, so kidney is responsible for something called acidosis, mean acid in the blood. This is acidosis. Now, for example, we have RTA. Okay, RTA meaning renal tubular acidosis. Acidosis because of the kidney, and they are types. Let's say, as the kidney has proximal parts and distal parts, because the kidney is about nephrons. The building unit for a kidney is a nephron, and it has part. One part we call proximal, and the far one we call distal. If the problem happen in the distal, there is a problem in the kidney that is affecting the distal part, we call this one RTA1, type 1, or RTA distal part. What's going to happen? We're going to have hypokalemia in the blood, because most of the potassium now is being dumped out because of that distal part become leaky, so it's leaking out potassium, so we become hypokalemic. What if the problem happened in the proximal part of the nephron in the kidney? Then it's the same thing. It becomes leaky. So it leaks out potassium. So whether it's type 1 or type 2, both of them leak out potassium. Both of them will have a condition called hypokalemia. Hypokalemia meaning the potassium inside your blood becomes low. Is potassium important for you? Absolutely. Without potassium, high potassium, low potassium, you get a lot of problems. So the potassium has to be normal. How we differentiate between type 1 and type 2? Type 1 is easy. Okay, you lose a little bit of potassium, which is the distal one, and that's it. But the proximal type, type 2, that's a bit more dangerous. Why? Because when the proximal part gets affected, you're not going to only leak potassium, you're going to leak glucose, you're going to leak calcium, you're going to leak other stuff, important stuff for you. So when you come to me and you tell me, listen, doc, I go to the bathroom 100 times a night, it's because the urine now having a lot of glucose. And when glucose increase to above 300 mgdl, then you tend to go to the bathroom a lot, because now the glucose is working as osmolarity force that draw water into it, and now as a result you go to the bathroom many times. You're not diabetic, but you're acting like one. You're not diabetic, but you're acting like one because of the bad kidney. We have RTA type 2, renal tubular acidosis type 2, that affect the upper part of the nephron in the kidney. So we discussed about the upper part. I mean, this is there's a lot more to it than just that. I'm trying to make it simple. So we discussed the upper part of the nephron, the proximal part, and what happened, the lower part, and what happened. Both of them hypokalemia, but the type 1 might find glucose and calcium and other electrolyte in the urine as well, because it becomes leaky. So type 2 is a bit more dangerous than type 1. So if you come to me complaining that you go to the bathroom many times a day and you're not diabetic, I have to check the kidney. Might be RTA type 2, renal tubular acidosis, or acidosis, a problem with the kidney at one of the parts of the kidney. There's type 4, but there is no type 3. Funny. This is how they classify it. Anyway, we don't worry about the types. I want to tell you about the symptoms. And this type here, the last type, is very much unique to diabetic patients. So if you are diabetic and you're not controlled, most likely you have the kidney problem. We call it diabetic nephropathology, or the kidney became sick because of the diabetes, by a process called hyalinization. So the kidney, some kidney parts become bad because of the diabetes. So as long as you are not controlled, we have a problem. What if you are controlled and have a problem? I still have to look at the kidney. It is very tricky, but the kidney is being affected when you're not controlling the blood pressure. Now, what is different, what is unique about this type of RTA, or renal tubular acidosis, compared to the other two? This one will have rather hyperkalemia. Hyperkalemia meaning high potassium in the blood. Say the other two types were losing potassium to the urine, so as a result the blood will have low potassium. This one here is holding on to potassium, meaning the blood will be rich in potassium. It's not leaky to potassium. It is holding on to potassium, so the blood will be very rich in potassium. Is this bad for the health? Absolutely. Hyperkalemia can kill you by heart attack. So if you are diabetic and you have high potassium, is a problem. Check your kidneys immediately. You may have type RTA type 4, renal tubular acidosis. That is bad. Now, but there is a trick here, because we have to be complete when we discuss things. When we are talking about a diabetic patient normally have high potassium. Let's say potassium is from 3.5 to 5.5. I expect my diabetic patient to be at the 5 area, 5.5. But if it goes to 6, 7, then we have a problem. This is what is called hyperkalemia. And now I'm thinking about, since my patient is already diabetic, then I'm thinking about renal tubular acidosis. We have acidosis in the blood because of that, and also hyperkalemia, because very much, you know, hydrogen and potassium, they are closely associated. When we have a patient with hyperkalemia, the chances are he's also acidemic, because the H plus, which is responsible for being an acid, is high. So how we do that? So you're not going to be doctors, okay? I'm not expecting you, but I wanted to stress out one point. Like we said when the urine with the stones, when we said urine must flow, you cannot keep urine. The same thing, we have to have a rule here. If you are diabetic and you do the potassium and is high, it's the danger zone. So potassium has to be okay. I'm expecting potassium to be high normal, 5.5 if you're diabetic. Why? There is a reason for that. When a diabetic means that you're not secreting enough insulin. What is the function of the insulin? Two things. It brings the sugar inside the cell, so the cell can use it and utilize energy, and it brings potassium inside the cell. So this is the cell. Outside my hand is the blood. So now the potassium will enter the cell, leaving the blood, making the blood less potassium, the cell more potassium, and that is the normal. If insulin failed to work, then nothing to bring my potassium from the blood inside the cell. As a result, we'll have high potassium. But I'm taking insulin, I'm taking some oral medication if I'm type 2 diabetic. Then what? Then, well, the potassium will enter, but it's not as if you are a normal person. Some of the potassium will still be high outside in the blood. So as a result of that, I expect any diabetic patient, the potassium to be a little bit high. 5.5. So when we have a patient that has a problem, diabetic ketoacidosis, what we say here, acidosis, acidosis coming from the, you will find the potassium also high, because there is acidosis. Okay? So now, if I fail to take my insulin, or ignore taking my insulin, or ignore taking my diabetes drugs, then what do I get? The insulin is not there, or the cell itself of the human resistant to the insulin. In both scenarios, I am not getting insulin to be secreted, or I'm not getting insulin to work. Those are the two types of diabetes. Either no insulin, or there is insulin but it's failed to work because the receptor is bad. So in both scenarios, the glucose is not going to enter the cell, because it needs insulin to enter the cell. And at the same scenario, potassium will not enter the cell, because I need insulin for the potassium to enter the cell. So I'm going to end up with what? Hyperglycemia, hyperkalemia, or high potassium in the blood, high glucose in the blood. Solution is what? Get rid of the potassium, get rid of the glucose. How we do that? Well, there is a protocol. We infuse a lot of normal saline to get rid of as much sugar as we possibly can, and then we do the cocktail, which is a little bit of potassium. You have to give potassium when you give insulin, because otherwise the guy is going to go hypokalemic on you, and that's going to be a disaster. Because when you treat diabetic patient, you have to know that you cannot drop their potassium, because they are used to high potassium anyway. The diabetic for many years, so we cannot drop the potassium below 5. Okay, that is the cutoff. We cannot drop potassium below 5. All doctors who are dealing with diabetes know that very well. So, but for you as a patient, if you're diabetic, we're going to have special sessions on diabetes, and we will be talking about it a lot, and we'll understand it. But now that we're talking about the kidney, I have to make you understand the relationship between diabetes and the kidney. So the diabetes can cause kidney problems, and it will be associated with RTA type 4, or in other words, the hyperkalemic kind of nephropathy. Hyperkalemic meaning the potassium will be high in the blood, and hyperkalemia follows with acidemia. So that's what we call acidosis. Acidosis, remember we're talking about acidosis. Acidosis, hyperkalemia, and we talked about acidosis, hypokalemia in type 1, type 2. Let's take 1 minute break, and then we'll come back and we'll talk about something different. I'm quite sure you are tired of listening to kidney now. Let's take 1 minute break, and when we come back, we'll play that video with the spiritual sessions.
Are you facing challenges in your health? Then Dr. Soliman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Soliman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Soliman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bulifamba, and in Douala, we are located at Entrepilor. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Soliman.
All right, thank you very much. I don't know, Mr. Johnson, can you play that that spiritual session, the hypnosis session? Because I got a lot of messages about it. They want to understand what's going on. They don't understand what's going on. So let's just play this one, and please, for the next few minutes, 5 minutes left, we can just shed some lights on what's going on there.
Yes, sir, how are you? Oh, a little better.
Alhamdulillah. Tell us about your experience now with the spiritual psychotherapy and the spiritual hypnotherapy we're doing for you.
Before now, I felt like I was carrying about 10 bags of cement. Okay. My legs were heavy, but in the course of 1 month treatment, I feel lighter now. Just that I want to be certain by the end of about 2 months to know how my body is responding.
But you felt the improvement?
Yes.
After the spiritual hypnotherapy we have done, me and my wife and you?
Yes.
You see the difference?
Yes.
All right, I appreciate you. Now this video will be shared online for other victims of black magic.
Yeah.
That there is a way out. Yeah. There is hope.
Yes.
Thank you. Thank you very much. So that was actually a story of somebody. The legs weight as if he carrying 10 bags of cement was not the only thing. Was not the only thing. There was other things also involved with this man. Like, he cannot progress. Everything he touches is not going. He's a very hard working. He has a lot of education, a lot of degrees. He works hard. He amazed me the way he works and his accomplishment. Highly educated man. Professional in everything. But he's not getting anywhere. When he get to, he works. When he gets to collect, is not there. And that's what we see. Let me tell you something. All diseases that humans suffer, 99% is spiritual. 1% is medical. And guess what? Is that 1% that we master. We know everything about medicine when it comes to the 1% body medicine. But spirit medicine, we don't know. We have no idea. We have no clue. And this is where we lose. It's only few people that are gifted to understand the spirit and gifted to deal with the spirit, not in their own power. We have no power. I have no power. It's God's power. It's not mine. So whatever I can do, whatever I did, whoever I healed, it is not my power. Let me repeat, it is not my power. It's God's power to selected people that he can select and bless and make them understand what is the spirit all about and how to maneuver and treat people. Okay? So 99% of our problems is actually spiritual. Only 1% is medical. But we have 99% of our understanding for that 1% and 0% for understanding for spiritual problems. And this is where we fail to understand a lot of things. We don't know. And it's very easy. This man feeling a weight of 8 bags of cement around his waist, carrying for so many years, and now he's relieved. Explain that medically. He cannot. And if I explain it spiritually, some people who are so hooked with the, let's say, evidence-based medicine and scientific things, and I see it, I believe it, I don't see it, I don't believe it, all this, let's say, hallucination, yes. I used to believe the opposite. I used to believe, I see it, I believe it, I don't see it, I don't believe it. And here is where I was wrong. At least a few years later, I admitted I was wrong. There is a lot of things that we don't see, but we believe. We don't see God, but we believe there is God. We don't see the waves that carry my calls to the next person in Bamenda, but we believe, right? But we don't see it. So there is a lot of evidence, you know, that if you under the effect, or you've been affected, or being victimized by some evil person or devilish power, there is a solution. There is a way out. You understand? There is a solution, there is a way out. What you need is God, trust and confidence. And look for means to get rid of whatever has affected you. And when you do not go to the wrong persons. That makes the problems a lot worse. Look for God, and God will guide you to the right person. I will end up this session now, and I wish you all the best holidays to come. Merry Christmas, New Year is very soon coming. And I will see you next Saturday, 5 p.m. This is Dr. Soliman, live with My Media Prime. God bless you all out there, and you have a beautiful weekend. Take care.